We've made it to the midweek, and we want to get you updated on coronavirus inside the Arizona numbers, the numbers coming out of the state of Arizona. But no matter where you're watching from, we hope we can provide you with some helpful tips to find the data in the area where you live so you can make the best choices for yourself and your family. You know their health and their lifestyle best. We're just here to guide you through the numbers and answer any questions that you post there in the comments. We'll get to those in just a moment, but Garrett, we start where we always do, on the summary page. A little bit lower reporting numbers in today.
Yeah, today was quite interesting. It was one of the lower numbers we've seen since on a Wednesday since the beginning of September. So we did have some very interesting movement in the actual date collection data. A lot of withdrawals today, a lot of additions in weird places. I did ask for the AZDHS if they had any idea of why there were so much changes today. I haven't gotten anything back, but so far, just to show everyone, I'll try to zoom in a little bit so it's easier to see. 323 new cases today with 18 deaths. It does appear that all of the deaths came from Maricopa County. It actually says 20 deaths, and then there's 2 other counties here. I don't know which ones, but there are 2 counties where they withdrew deaths from the report. So all of the deaths came from Maricopa County today. 323 reported cases, like I said, very low for a Wednesday, but we also had a very low diagnostic test number. This is one of the lower test numbers we've had since the beginning of September. So this is sort of a pre-ASU, NAU, U of A testing number. So we'll see if that's because they're sort of done with their initial testing of all the congregate settings using the antigen tests, or why we just had a lower number today. But we certainly had a lower number, and it shows up in those cases as well.
Yeah, it sure did. I noticed that exactly as I was looking at that summary page today. Laura's writing, time for no more masks and everyone in school. Laura, you have your wish if you're in Lake Havasu. Lake Havasu City has just lifted their mask mandate. They had extended it twice, but it has since been lifted. So that news just coming out of Lake Havasu City, obviously a popular spot on the weekends and a spot for boating as well, but wanted to get you updated on that. All right, so Garrett, when we look at this summary sheet and we see, thank you for explaining the difference in the death count there, because seeing 20 in Maricopa County, but then 18 across Arizona can raise some questions. So thank you for helping us to better understand that. Do we know where these tests are coming from? Which are PCR, which are the diagnostic tests?
Well, we don't know, unfortunately, what's an antigen test and what's a PCR test. It's just something that the AZDHS doesn't disclose. What I can tell you, though, is looking at the zip code data from today, it does appear that the majority of cases that came in today came from, it appears, actually, there's been a lot of cases coming from 85009, which, if you recall, that's Lower Buckeye jail complex, and so it looks like there's still some congregate testing going on over there. So that's just something to consider, that there's still some pretty large growth coming in from Lower Buckeye jails.
Okay. And as we can stay on this page for just a minute. Normally the percent positive is one of the things that we look at very closely. And just to remind everybody where to find this, on the results that come in of the percent positive, there are a couple places to look for that percent. We can see the life of the pandemic on there, but also, and perhaps more importantly, a snapshot of where we are right now is to look at the week to week portion of those percent positives coming back. That is, Garrett, let's see, under the lab testing page on the summary page?
Yes, we'll look at the lab testing page. That's going to be exactly where you find that information. Again, I'll try to bring this a little closer just so it's a little easier to see. So for Arizona, this is one of the most important graphs we have. It's this percent positive in the diagnostic testing portion. And we can see right now that week over week right now, we're still in the percent positive of 4%. We've been there for about since September. So since the very beginning of September, we've been in this 4% range, and we haven't had a lot of movement there. Slight ups and downs in the 4%, but not enough to round it up to 5%. So this is good news in regards to all of these tests that were done, especially the new ones that were done in September. Everything still sort of stayed around 4%. Now, that's just Arizona. If we start to go into other locations, we can see numbers will fluctuate. Pima 6%, 5%, 4%. We go to Coconino, numbers are very different: 6%, 7%, 13%. Even though that's only 4 tests, or 32 tests, but you can see sort of this changing numbers as we get to some of these more rural counties. Here we've got Gila County on September 20th going up to 7%, and I could pretty much go on for all the counties. Maricopa obviously drives this bus. The majority of the tests come out of Maricopa, but there is some fluctuations in some of the other counties to watch.
In particular, some of the counties we're watching closely: Pima County, Coconino County. We had kind of flagged Pinal County for a bit. How are things looking? Because tomorrow, of course, we get the very latest updated information on how each county looks. And we had to meet all 3 benchmarks in order to move into a category to let some of these places open back up a little bit. How are things looking county to county, especially in those hot zones, if you will, that are seeing some increases?
Well, I'll tell you, I put together a quick little chart for all of these counties. I'll have to share and come back several times here to get it working, but this is a Coconino County's chart. And this shows you exactly where we're headed for tomorrow and the next week. And this orange line here is the 100K line. Once you pass this, you go, you're over in the substantial transmission as far as the per capita number in your county. And for Coconino, you can see that it soared past that number to 216 for the week of 9/13, the week that will be calculated on Thursday. And then they're at about 180 for this current week, 9/20. That's still filling out, but it's near done. So I'm going to switch this over tomorrow. So, but there's Coconino. We'll look also at, we said, Pima. Let me just regenerate the graph, and then I'll bring it back up. Pima's a slightly different story. They just barely went above that per 100K. And then you can see on their 9/20 data, it's much lower. So you can see this is definitely the result of U of A testing that happened during these 2 weeks. And then they're not really doing as much follow-up testing, or they don't need to do as much follow-up testing. Whatever the reasons are, I don't know. But you can see that the per capita number for Pima for 9/20, which will be calculated in 2 weeks, is very small compared to where it is. In fact, it's lower than it has been since August. Now, this data can still be updated. It's not a complete and full week, though, but I don't really see it adding another 50 per capita in the next week. That's sort of a long stretch. I don't think that's gonna work.
Yeah. Of course, the official calculations come out in the morning, but we wanted to kind of give everybody a preview of how things look in those particular areas. I'm getting lots of questions. And first of all, Tiffany has a question about Pinal County and how things specifically look there. That was one of the areas that we were watching so closely. Maybe we could show her some of the business graphs and or school numbers coming out of there.
Sure. I'll go back to the AZBHS for Pinal County because their numbers they're not in danger of going into transmission into
substantial.
Substantial. Thank you. My apologies. So I'll just go right to the school graph for Pinal County. We haven't shown the school graph in a couple days, but we only show it on Wednesday, Thursdays, and Fridays anyway because we have them recalculated on Thursdays. So here we go. This is Pinal County. You can see well under where they need to be for the per 100. On September, you can see there's a drop in cases, 35 to 24 for the week of September 6th. I believe that drop is going to continue. I'm looking at the chart right now. No, they will post a gain tomorrow, but it's a very small gain. It's only going to go to about 27. So it's gain about 3 points. But you can see not in any danger here. They're still under the 7% in Pinal. So they're going to remain in this that benchmark period of the hybrid. They're still very much there.
Okay, I want to get to more of the questions. Tiffany, thank you for that question about Pinal County. Let's see. JD was saying, haven't seen my mom since March. She has Alzheimer's and is in a nursing home. This needs to be addressed now. Hopefully that they are making some plans for you to be able to see your mom. They had started to put some new plans in place, get some testing done so that everybody can get back in to visit loved ones that they have been without for so long. So JD, we understand what you're going through, because we're hearing from a lot of people experiencing the very same thing on here. So let us know, especially here in the newsroom, if you have any specific problems with getting in. That should be something that has been addressed already. So keep us updated. Karen's asking about a COVID forecast for winter. When we're looking at some of this forecasting, we've been able to dip in there a little bit this week. The farthest out they're forecasting right now is until January, is about the farthest out that I've seen. Is that what you've seen, Garrett?
Yes, and that's the University of Washington's forecast. That's the one we sort of look at because it's more well known than some of the others. It uses sort of the same parameters as a lot of the other forecasts out there. So, you know, you're not going to be getting very different numbers as far as, you know, looking from forecast to forecast. But we do have that. I have it ready. Let me just share the screen. And again, this is the University of Washington, the IHME model. This was this back in April. March, April. This was a big model. Everybody used this model, and it sort of, in my opinion, you know, fell out of favor for a little bit, but it's gotten a lot better. So that being said, let's look at what it says is going on. I'm going to take out masks or easing right now. Let's just presume. I'm only going to presume the actual projection right now without any of the other mandate policy decisions. So here you can see all the way into January, this is our projected death numbers, and it does presume there is going to be, obviously cumulative, there is an increase in projected death numbers, saying it's going to end at around 9,330. So that's a range of about 6,000 to 14.7 thousand.
And that was for deaths, Garrett?
That was for deaths, yeah.
Wow.
Yeah, and this is the projection for daily deaths. You can see it does as right now, this particular projection is presuming there will be an increase in daily deaths. We have not seen that right now. So we haven't seen this borne out. So in fact, it's saying that our deaths are going up in the projection, and our deaths are not going up in the projection. So that's something to consider when we're looking at this. So it does say that it's going to drop pretty precipitously after December 27th. Not really sure what that's about, but you know, that's what we're looking at. So here we're going down to daily infections. Again, there's this very interesting drop on December 11th to 14th. I wonder what that's about. To have such an immediate drop like that is very rare in projections. I wonder if there's a math error in their projection today, because you just don't see that very often.
Yeah.
You'll see these gradual downward slides, but something like this is sort of interesting. But this one, let's take it up to here, December 11th. That one says that the daily infections, and this is not confirmed, of course, this is estimated. It includes those who are not tested. It believes it could increase to 22,000. But the range here is incredible. It's 3,400 to 49,000. That's again, agnostic to who's getting tested. That's a huge range that it presumes could be walking around with COVID in Arizona.
So Garrett, and you can pick whichever model on this particular sheet as an example, but I'm seeing a lot of things in the comments that like masks don't work and they don't matter. This allows us to add masks back in. So if you want to go to the infections page or the deaths page or whatever, it's a better illustration of how masks do indeed work and affect the projections.
This does have, as you can see, it does presume some universal mask mandates. Now, in my opinion, I think that these projections are probably a little bit too aggressive for universal masks, because we essentially have, in many cases, universal masking here in Arizona right now. And for it to be that divergent from where it is right now, what this is, I'm not sure what their methodology is, if they're presuming, you know, mask mandates inside and outside or whatever it is for universal masking, because we pretty much have it here. But it does show that you know, in their calculations, when you put in masking policies, the numbers go down pretty substantially. At least that's what they're calculating in here.
Okay, we can spend a little more time on this, and then I want to move over to schools, because Christy was asking about our schools, and I want to make sure that everybody finds that information as well. One of the best places to look, because schools don't have to, here in Arizona, share their COVID-19 cases or their exposures publicly. They do have to let parents know. So oftentimes parents will receive an email or they'll get a letter sent home. Since kids aren't necessarily all in school, how there are many different ways that they're communicating with parents at this point. They also have to let the Arizona Department of Health know. We do keep track of exposures here at ABC 15, but we rely on all of you to pass those along to us. There is one place that you can go and look and find all of the ones that we do have, and it is on abc15.com/schools, and you'll be able to find a dashboard that we've created there. It's got a whole section on any schools that have had exposures. We told you yesterday about Cactus Shadows having to quarantine their entire football team, their entire varsity football team. So about 60 kids were sent home. And then Joyce was just saying a minute ago that her granddaughter, I believe she posted about, Joyce was saying that her granddaughter was at school, got a letter about exposure, and is being sent home for 2 weeks. Yeah, a classmate right there tested positive for COVID. So that's not unlike what we're seeing across the valley. And as I mentioned earlier this week, they're starting to test those more often who are in that 2-week quarantine to see, do we need to stay in quarantine for 2 weeks? Could that be lowered to 10 days or 12 days? And that would help us get back to business, back to school, back to everything a little bit faster. If we can, Garrett, narrow down that window and have a better idea of when people are not transmitting the virus.
Yeah, so exactly. And that's one of the reasons why we have to look at these projections, is to sort of see what policy decisions and other things can impact whatever mask mandates, whatever sort of mandates can work to mitigate the impact and see where things are going. At the same time, you have to compare these models to real time and what's actually going on, so that you can hone them over time. It is one of the reasons why I didn't go to IHME before, is that without the data that was being fed into the model, it was being very aggressive on its presumptions of what was the difference between mask and not mask back really early. It was, the difference in Arizona was, it was massive. I mean, it was saying we were going to just blow up in hospitalizations within a week. And of course, that never happened. So, but as data has come in and they've recalculated and recalibrated, the models are much better now. So we do have to watch these things and observe them and also compare them to real-time data. This is something that a lot of people haven't dealt with. A lot of data scientists and a lot of epidemiologists. It's a 100-year event. So it takes some calibrating to make sure that we get this stuff right.
Yeah, and that goes into Mark's question there as well. He's wondering if the data gets better in November, and I'm not sure if there's anything more unsaid in that question there, Mark. But I can answer it with this: the more information and the more data we have, the more accurate it always is. So April is more accurate than March. July is more accurate than May. The more information we can learn about this virus and the more data that can come in is more to analyze and more to understand. So I don't know if there's more to that question based on the election, but yeah, either way, the length of it.
Yeah, I mean, at this point, you look at, I'll go to my projection site that I like to go to, the one from MIT, because it's a little bit more, a lot more conservative because it's used by machine learning. And as you can see, I know people say, oh, this thing is going to be over on November 7th or November 3rd. And of course, I know that there's a political ring to that, and I completely understand at least the sentiment of people that might think that. However, you're seeing like some of these projections that are not, these are not messed with. This is just calculated by a computer every single day. It doesn't care that there's an election on November 3rd.
Yeah.
This one certainly doesn't. And on November 1st, you can see in Arizona, you can see a slight uptick. So this projection is saying, well, I mean, you should kind of watch what's going on because at least there might be an uptick. Let's go I'm just going to pick a random other state. We'll go to California, and you can see California, the line is also going up. So a lot of these are saying that, you should at least watch what's going on, because in some of these cases, when we're looking at what the data looks like and what's happening, we are seeing a potential for an increase around November. So just something to keep in mind, especially when you look at a model like this that doesn't have any, it can't be used for something like this. Literally, a computer recalculates this every day. It, again, doesn't care that November 3rd exists.
Yeah, exactly. And the virus is in 188 countries. It doesn't care when the U.S. election happens in those other countries.
That particular model doesn't care. Most models don't care, but that's a good example of a model that can't care because there's no one in there in the background changing variables.
Right.
That's why I use that one, because you can't, you can't say, oh, well, with this variable, it's going to change it, like that.
Yeah.
But those variables have been set for quite some time, and they don't change very often.
Yeah.
So.
Debbie's writing, also last week you said Litchfield was in the green and could open their schools. So now they added this. It's a political statement at this point. So just because they've met the benchmarks to open doesn't mean they are required to open at this point. I'm in the same boat with my kids' school district. They are getting closer to the green. They're not open yet. There's a lot of other things at play, getting the educators back, getting the staff back, getting everybody in place. So it's not just like they hit that mark and then they're able to open. Carrie writes, it'd be interesting to see what the projections are for Florida now that all these restrictions are gone. That's also one of the states that we'll be watching closely. As I mentioned yesterday, when just for a quick multiplication here, remember 21 million approximately people live in Florida and 7 million are here in Arizona. So when you want to compare those numbers, just quickly say you're watching the national news, just think 3 times the rate of whatever we're experiencing in Arizona, and that'll give you a good baseline for measuring that on the fly. Garrett, you were going to add something about that.
Oh, I was going to say, no, that's a great point. Whoever said that about Florida, because, and I'll bring back up the MIT projections.
Mm-hmm.
As we talked about, the variables aren't messed with. And as of right now, there is no sort of massive increase in Florida that doesn't sort of follow what's happening in Arizona. So there's no one in the background saying, oh, wow, well, they've just released all their mask mandates, so let's jack these numbers up. This is, it doesn't happen that way. So I'm just saying that's why you can trust some of these models to not really monkey with the data. This one is not monkeying with the data. It's just right there. If things happen in Florida, it will react to what happens in Florida. If cases start to rise, this projection will start to rise. But until then, it's sort of following on the same trajectory of Arizona.
So if you guys do want to continue to check this site, this IMHE site, it updates.
This one is COVID-19 projection.
Yes, that's right. That's right. When does this one update? I know the IMHE, I wanted to mention that it updates on usually like midweek, Tuesday or Wednesday, and then oftentimes we'll see it update on a Saturday. How often does this one update?
So yeah, the IHME site does, the MIT site updates every single day. What I'm looking at right here, this one updates, you can see it last updates, and it updates every single day. The IHME site, you are correct, it does not update every single day. I'm going to it right now. And this one, it will have.
It should say right up at the top, right? The third line, September
24th on Pacific time. So this one does tell you when it updates, but it is not daily.
Yep. Okay. So one other thing on Florida while we're talking about that, FSU has just said that they are canceling spring break. It remains to be seen if other colleges are going to follow the same suit, but FSU is saying we're skipping spring break. All fun and games, Garrett, until they cancel spring break, right? January 6th is when they're going to start class. So a few days later, and then they're actually going to end April 23rd. So a little bit sooner. So they're just crunching that spring semester in a little bit, starting later, ending earlier, and saying, too bad spring break is not happening. We'll see if other schools sort of follow that. On the same note, a lot of Florida topics today. Miami-Dade classrooms do open back up next week, and so we talked about some of the changing restrictions there. So a lot to watch coming out of Florida today.
Karen Roberge, and I'm sorry if I said that wrong, is asked what states have the least infections. So DVOC, 91-DVOC.com, we do go here every once in a while, does give us some great numbers for this. This is by per capita, this particular one, but you can actually do this cumulative, so you can see what the cumulative per capita looks like. We don't look at this very often. You can see that Arizona is actually pretty high up there on the cumulative chart. Once again, cumulative, it can't go down. That's the whole point of being cumulative. It keeps going up. But you can see Vermont and Maine and New Hampshire have the lowest per capita case rates, cumulative case rates in the country, followed by Oregon, then Hawaii, and then West Virginia. If we go to the non-cumulative, which is up here, this one we can, wait, is this, no, this isn't. Okay, so I can go to total cases. And this one, I mean, you can see this one because now we're talking about bodies of, massive populations. Vermont is still down below, but now you've got, California, Texas, Florida, New York, all the big ones are up top. simply because of their size. And Arizona's sort of on the top of the middle list, but we are a middle-sized state, so you would sort of expect to see that.
Yeah. Well, while we're on the topic of this, the R naught number today did jump back up above 1. I believe it was at 1.03. It kind of puts us in the middle of the board again.
Yeah, it does. It puts us in the middle of today, 1.03. That range is 0.82 to 1.26. And it did, sort of detect. If I pulled off debug 91, I probably shouldn't have. Let's go back really quick. Let's see how we could sort of get to that point. So if we go to our total cases 1 week average, you can see that it is detecting a slight increase. So there has been a slight increase in the reported case averages from the past 7 days. That is true, although there was some backfilling going on the last couple days. So that's just something to consider. But there is a slight increase, and that's probably why the RT has gone up to 1.03.
Garrett, do we know how, I don't know if you know this, how widely other states are testing when we're seeing that we have seen 1.7 million results here in Arizona? Of course, we were saying today was a little bit lower with only 4,500 results in. And we've seen things fluctuate, whether places had enough testing or they had enough people to process the tests, or labs, or every step of the way we've had to make sure everything's working to get the results back in, not just get the swab or get the saliva test. But do we know, is there anywhere that's actually updating a list of how many tests are being done nationwide? Have you seen anything on that?
Good question. I believe there are, but I don't know. Hold on one second. I believe there is a place. I believe that's on the CDC's or the the Health and Human Services dashboard. I believe that does have like cumulative tests for the entire country.
Yeah, it's fascinating because just for perspective on how widespread testing is, it's a question we get so often. And while we're on the topic, before we're hearing from so many different people asking about deduplicating, they do deduplicate the test results. So for instance, I've had both just a regular PCR or a saliva test, and then I also had an antibody test. I only count as me. I'm not counting as multiple tests in there. So they work to deduplicate those. And I'm also seeing in the comments a lot of people asking each other about nurses and doctors. We have a ton of medical professionals who watch this, and I want to thank all of them for joining us. A lot of nurses and doctors join us each afternoon and share their wisdom and share things that they're finding out there. So I just want to say thank you to all of you for joining us on here, but especially those in the medical field who are offering information as well. We appreciate your insight into this. Any luck, Garrett?
No, not yet. I'm still trying to find it. I'm sorry.
No, it's okay. I was just curious.
I spent all my time on Arizona that when someone asks a question about like all the states and
I feel you.
Oh.
No, I think the same thing. You and I have spent months now staring at these Arizona numbers. So it's I find the same thing happening to me. I'm like, I can recite every Arizona number, but ask me nationally, and I have to take a minute to go back in and look for it in there. So just a fascinating thing. If we find it, we'll share it with all of you throughout our conversations here each day. By the way, we were on a little bit late today. We want to say to those of you who are watching live right now, I know this replays in the evening on some of our favorite streaming devices, Roku and Apple TV and all those out there. But for those of you who are watching live right now, we were on just a little bit later today. That's an anomaly. We'll be back at our normal earlier afternoon time tomorrow as well. All right. How do hospitalization numbers look, Garrett? We've kind of neglected that for the past few days because we've been so busy with some of the other numbers. And I know we're going to be so very, very busy tomorrow when our zip code map updates and our schools and business dashboard maps and graphs update. So I want to spend a little bit of time on the hospitalization numbers. Oh, and Carol, thank you. Carol writes a huge thank you. Always, Katie and Garrett. Thanks for joining us, Carol, and thanks for saying
Absolutely.
that. We appreciate it.
We'll go. Thank you very much, Carol. We'll go over hospitalizations in a second, but I did find some testing data, so I wanted to just put that out.
Oh, great.
From John Hopkins. If we've actually go to this site a lot, I just didn't realize if you go in this insights, you can sort of see it. So it really shows testing by total populations here for all the states. And you can see North Dakota, Rhode Island, and Alaska, Massachusetts, and DC, New York are all on the top. And then it starts going down from there. Arizona is pretty. Where is Arizona? Arizona's pretty far down on the list for total tests per population. Is this case for testing? This is testing. So yeah, this is tests. I just want to make sure. And you can see right here tests. You know, it's
Wow.
so just you know, something that here's the weekly changes. Very interesting data here. Let's see where Arizona flies on the weekly changes. I can't even find it. It's, you know, maybe if I put these, can you order these? I don't even know.
Well, this is
Arizona.
there we are.
Little increase. There it is. Okay, little slight increase from week to week.
So interesting to see that. I'm impressed that you found it that quickly. We
Googling.
Well, that too. These pages are they'll sneak in new information on us in there. So I know so many times you and I have said, "Oh wait, you know, I went on this page that we've gone to countless times before," and then today all this other info or demographics, different metrics to measure this is all added on there, which just makes it interesting to learn a little bit more about COVID as we make our way through this. Okay, so hospitalizations.
Yes, let's do that. Super
yeah, I
important.
don't want to miss it because we are going to be so busy with all of that happening tomorrow. So I know we're in pretty good shape overall, but how do things?
Yeah, we had some slight increases in the census data today, but it seemed to have come more from non-COVID-19 patients than anything else. You can see we've had a 3-day increase in the ICU census. However, again, the numbers coming from non-COVID patients at this point. And then if we go to inpatient data, the acute care, you can see that's also a small increase, but that increase being driven more. There has been an increase of COVID patients, about 20 more COVID patients from day to day, but mostly from the non-COVID patients. That's where the increase came today. About 80% of our acute care inpatient beds are being used. And then the ED emergency room bed count, about 42%. That is up from yesterday at a 41%. But again, we were on, as you can see, I know we talked about this last week, when we were here in 918 to about 923, there was this gradual sort of spiking a little more. It was making me a little uncomfortable, but you can see it started to even out. So that's good news. Again, ventilator use, general ventilator use across the state, still everything's down, no movements there. Going to the COVID-19 data, like I said, a slight increase, but more of the same, leveling off of September in the inpatient hospital data. Ventilators down again, but again, we're hitting record lows on ventilators. We have been for quite some time. ICU beds slightly down from yesterday, but only slightly. We're still in this sort of under 120 range, 110 to 120 right now. Discharges up a little bit. Emergency room visits up again a little bit, but again, only slightly. Nothing that sort of should be used to be alarming quite yet. And then the intubations down to 41. So all in all, like we talked about, really good hospitalization data again. Nothing to be alarmed yet. None of the indicators are going off at this point. So, but we're always observant just to make sure.
Yeah, that's really good news. I know I on the ventilator front, we've always been in pretty good shape here in Arizona. I want to make sure, does that graph split out to those who on a ventilator for COVID versus other reasons, and how do you think that will change going into flu season? When are they marking that separately? Can we find that separately, or teach folks where to find that?
Well, we have, let's see, I'll just do I'll bring up my old calculator here. It looks like about 13% of the ventilators in use in Arizona are for COVID patients. The rest of them are marked for non-COVID. There's 423 ventilators being used. I lost the page, but yeah, 421 ventilators, excuse me, and then about 55 COVID-19 ventilators. So that's about, like I said, 13%.
Yeah. Okay. One other thing, we always talk about the kids, and we're watching that under 20 group very closely. It makes up about 14% of our total cases here in Arizona. We've watched that number climb just a bit over the past few weeks and months. Under 20 is the basically the only number we get from the state that we can split that into. So we don't get like under 10, under 5 years old.
Correct.
We're stuck with that under 20 group. We can look over on this NorQuest site, them being one of the large providers of tests, to learn a little bit more. Since we're on this demographics page here for the Arizona Department of Health, we'll teach you all where to find that right here. It splits into the groups by age, and Garrett's hovering over it. And when you do that, you can see the percentage. How many total? We're getting close to about 30,000 young people.
We're getting there. Thankfully, we only grow right now by maybe 100. On bad days, we grow by a couple hundred. This group is still sort of the highest growing, fastest growing group. Sometimes it grows faster than others. Today, thankfully, it didn't grow very fast. It was about in line with everyone else. But it's more often than not, it's the fastest growing group of the bunch. And it's at 29,744. Likely to hit 30,000 next week, probably, being that it's Wednesday. We may have it happen on Saturday, but it really depends on what the case numbers look like.
Yeah. Okay. So when I was mentioning that SonoraQuest site, we do get the age group split a little bit further on that page. Obviously, it's not the only provider, so there are limitations to the numbers that we can gather from that page. But it does and they took it down for a while. It wasn't up this whole pandemic. But at last check, they did have those numbers provided, which if you were super curious about that under 20 age group, it just gives you a little more insight into it. Again, the limitations are that they are not the only provider, so it is not a complete number that you will see. But because you are looking at mostly in Maricopa County and you're looking at one of the biggest providers, it does give us a little bit of insight. What does that say as far as the under 20 group?
I do have that up now that you prompted me to go there. So we're at the SonoraQuest testing site. Again, this is by number of orders and whatnot. And you can see this has detected patients 108,000. SonoraQuest has detected 108,000 patients. And it looks like here's your numbers for these age groups. You can see about 2,000 of the 108,000 are under 5, and about 11,000 or so are under 19. And then we really get into the bigger numbers as we get to 2044, which that is, as you can see, about 50,000 or so, 60,000.
Yeah, and it makes sense because that's likely the most mobile group of all the age groups. So they're out and about, and if they feel sick, they can.
And it's also the largest of the just raw number age group.
Right.
I mean, you've got under 5 to 19, and then you've got this massive group of 24 years.
Yeah.
It's just these are epidemiological categories. They're not supposed to be balanced. 20 to 44 are people that are not impacted by diseases as much as the other categories. So they're lumped together as sort of, these people are going to get sick, but they're probably going to be more okay than some of these other categories. And that's how the epidemiologists put this data out. And that's why this is such a large group.
Yeah. Amanda's got a really interesting question. And Amanda, I want to help answer it for you. She's writing, if that age group is going up, why aren't we seeing those numbers in the school district's outbreaks site? So they actually don't have to provide us with that information. So the only way you would necessarily see the school district outbreaks is if you had a kid in that particular school, not even necessarily the school district. So that's why I always stress it's so important to ask your child or your grandchild's school district how they plan to communicate that information to you. I mentioned this earlier as we were chatting today. Sometimes parents will email us in the newsroom the letter that they get, and we add it to our dashboard. So if you want to check that out, that's on abc15.com/schools. But we won't necessarily see that reflected because they're not forced to share the information with everybody. So really good question, Amanda. I hope I answered that for you. Kimberly writes, so it could be all over the schools and we wouldn't know it.
I mean, it could be, but the reality is when we look at the ASU and U of A and NAU numbers, the vast majority of those 5 to 19 are over 18.
Older,
and they're in the colleges. I mean, we have data that shows from those colleges how many people over the last couple of weeks have received, and their students that have been tested positive. So we know that a lot of those numbers are coming from that portion of the age group and not 5 to 18. So very important.
And because if it really was all over, we would most likely hear from some of those parents
Yeah.
who are saying my kid's homesick or my kid has to be home because the person who sits next to them is sick. So not necessarily the case in all of this.
Yeah, I mean, everybody's on social media now, and if everyone's starting emails from schools saying this person had COVID-19, I agree with you. I think we would just see it.
We'd start to hear.
We do see it on social media when people, we almost hear about it all the time. So if it was happening more often, we'd probably continue to hear about it.
In fact, this brings up something super interesting, and I want to credit all of you who are join us on here each afternoon. Garrett, if you noticed, before we saw the reflection in the Coconino numbers, we were getting a lot more questions about Coconino County in the conversation.
Yeah.
So just the things that you guys are asking, we always say we see a higher number of tests, then we see a higher number of cases, then a few weeks later we see a higher number in the hospitals, then sadly we see a higher number in deaths. And do I dare say that we see higher numbers of comments in a particular area before we ever see it reflected anywhere else? And a couple of weeks ago, we started to see a lot of you asking about Coconino County, and then we were showing you the numbers more and more, and then we were starting to see that in the testing, in the results, in the cases, and now we're seeing it's one of the counties on watch for tomorrow's updated county list. So that's a credit to all of you and reaching out. So thank you for that. All right, that about does it for the day. Oh, you know what? And they shared that. If you do have news tips for us, you can always send it to the newsroom to share at abc15.com. If you see something that's not quite right, you want us to look into, anything you need, share at abc15.com is the place to do that. For all of our coronavirus reporting, you can find that at abc15.com/coronavirus. We do have newscasts a bit adjusted today. I have to think about when they are. We have a 4 o'clock and a 5 o'clock. It's June in Arizona, even though it's October, because we are having NBA playoffs starting tonight, which is just so crazy to think of. I'm used to working in the hot summer and covering those games. So things are going to be a little bit adjusted tonight. We will have a newscast after NBA's game 1, which it'll be around 8:30, 9 o'clock, somewhere in there. We always have our news over on CW 61 at 9 o'clock and then on ABC 15 tonight at 10. So plenty of places to catch us throughout the afternoon. A lot more coronavirus reporting there. You can find Garrett. He's very busy on elections and those numbers as well, but you can find him on Twitter at Garrett_Archer. I'm on Twitter at Katie Raml. Oh, I'm saying go Lakers, really? Carol's a Lakers fan. My Twitter account at Katie Raml. You can also continue the conversation if Facebook is your preferred method over on facebook.com/news from Katie. Kimberly's writing, can we order some cooler weather for next week? Woo! Sure hope so. I'm with you. It's fall break. I won't be here next week. So hopefully it's a little cooler. All right. That's it for us. Be safe out there, everybody. We'll see you back here tomorrow at our normal time.